Assalamualaikum warahmatullahi wabarakatuh. Okay guys, I want to tell you about healthcare provider protection protocol in the era of COVID-19. Before that, I want to introduce myself. My name is Qinnisa. You can call me Itta. I come from Accounting 4B. Okay, let's begin.
Information about the coronavirus that is so abundant can be even confusing. Therefore, we need the handling health protocol COVID-19. This protocol is implemented by health workers in the field and the need to be followed by community who is potential exposed to the coronavirus. People who have travel history of 14 days ago to a country with 19 COVID local transmission or feel contact with patients with positive confirmation COVID-19. What needs to be done if the two conditions are met? If you feel healthy, then it is advisable to quarantine yourself at home for 14 days while monitoring the condition of the body. If you feel unwell or symptoms arise, immediately report to the healthy worker or contact the Corona Hotline Center to get a health examination referral to health service facilities. What symptoms need the attention? Fever exceeds 38 degrees Celsius, cold or runny nose, sore throat, shortness, or respiratory problems. Do you need to come directly to the health service? If symptoms are mild, contact the Corona Hotline Center or the nearest referral hospital for information about the next steps. While looking for this information that needs to be done, still avoid going out of the house, outdoors, drink a lot of water and eat nutrition food. Practice clean habits like washing hands, use a mask so that fish from tagging or sneezing won't hit other people even in the house. When to seek additional medical assistance if the symptoms are feel enough, for example, receive shortness of breath of if you are in the classification of vulnerable groups because over 60 years of age have chronic disease such as diabetes, hypertension, immune disorders, and a history of respiration illness and other. What needs to be done if symptoms continue and need to go to a healthy facility? Use a mask when going out. Practice the correct checking and sneezing ethics by covering with elbows or tissue. Avoid using public transportation. What are the stages of screening patients in healthcare facilities? Before providing care of health workers in healthcare facilities will conduct screening. If it doesn't meet the patient's criteria and supervision COVID-19, it will be inpatient or outpatient depending on the diagnosis and the doctor's decision. If it meets the criteria of a patient in supervision COVID-19, it will be referred to one of the referral hospitals accompanied by a health worker who uses personal protective equipment. At the referral hospital, the patient specimen is taken for a laboratory examination and the patient will be placed in an isolation room. Specimens are sent to the Health Research and Development Agency in Jakarta. The result of the field examination will come out in 24 hours. If the results are negative, the result will be treated according to the course of the disease. If it is positive, then the patient will be declared as a COVID-19 sufferer. The sample will be taken daily and will only be removed from the isolation room if the examination of the sample twice in a row is negative. That is information and health protocol for the COVID-19 problem that need to be followed by the public. Illness due to the coronavirus can be cured, but so it is better to prevent and not transmit it to those who are more vulnerable.
Okay guys, I think enough. Thanks for your attention. Open the full. Wassalamualaikum warahmatullahi wabarakatuh. Bye.